Hello, everyone. Welcome to the MassChallenge Innovation Summit, Global Perspectives on Health and the Pandemic. We're really excited about this conversation today. I was thrilled by the conversation that we had around a month ago, where we brought people together to talk about really what was next, what was coming, what was this pandemic going to look like, and unfortunately, it's looked at times worse than we thought, at times better, and it's been amazing to see the response of the innovation community to address this pandemic. It's been amazing to see the response from the partner community, the startup community, the global network, and what we're doing to address this pandemic. And I'm excited for the conversations that we're going to have today, the learnings that we're going to have today about what we can do next. So I'm Nick Doherty. I'm the managing director of MassChallenge Health Tech. And at MassChallenge, our mission is to solve the world's massive challenges through entrepreneurship and innovation. The health tech program is focused on healthcare and health tech, but we are a global organization. And so this is exciting that we are partnering with the MassChallenge Israel program to bring you this event today. And this is the first of many in a series coming up, and we'll let Yonit talk a little bit more about that later. So why are we here? We are here because you asked us to do this. We kept hearing after our first summit that people wanted more. They wanted to know, what are our provider organizations doing around the world to address this pandemic? They want to understand, what are our startups doing to support our recovery and helping us both be healthier, get back to work, live in this weird and crazy world that we're in, and also what are organizations doing to address and adapt during this pandemic. So we're here to have those kind of conversations, and we can't wait to hear the questions that you have, and we can't wait to hear what our panelists are going to talk about today and what our innovators are going to show. So in terms of some immediate steps, I know that we shared this the last time, and I wish that it wasn't still true, but it's still important in so many settings to continue to wash your hands, practice social and physical distancing, to stay at home if you can, to clean and disinfect your environment around you, and please don't hoard medical supplies, donate them, because we still need the help on the front lines to be able to support addressing this pandemic. If you are an innovator and you've got a solution that you want to bring to addressing this pandemic, please submit it at this link. We would love to have you included in our portfolio of solutions that we're addressing this pandemic with. We're part of the COVID-19 Healthcare Coalition that has, I believe, over 800 organizations, including the Mayo Clinic, including Takeda, including Microsoft, and many more that are working to address this pandemic. And so we would love to bring your solutions into that. Through this effort, we've been able to secure millions in PPE, and it's just been fantastic to see the results of this collaboration. This is really what we can do if we join up together to solve massive challenges, and this is a pretty big one. So in terms of ground rules for today, if you want to check out the agenda, if you go to masschallenge.org/Global Innovation Summit, please use the Q&A feature to ask questions. We would love to have you promote this on social media using hashtag MC Innovation Summit, and make sure to tag MassChallenge as you do so. So I want to dive right into the conversation. We want to start with a global perspective and talk with a few health systems, one in the United States, one in Israel, about what they're doing to support innovation and address this pandemic. So we have really an all-star lineup here. Kelly Hall is going to be our moderator. She's the Senior Director of Healthcare Transformation and Innovation at the Massachusetts Health Policy Commission, also bringing a perspective of the Commonwealth of Massachusetts and seeing what all of our providers across the state are doing. We have Mark Sang, who's a medical director at the Brigham and Women's Digital Innovation Hub, bringing a perspective on innovation as well. Is David Klein, who's the head of ventures and innovation at Asuda Medical Centers in Israel. So really excited about this conversation. I'm going to pass it off to Kelly and take it away.
All right, thank you so much, Nick, and thank you for everybody who's joining today. You know, I was really, really excited when I was asked to facilitate this panel, because I think, like many people, I've been really watching with awe what our healthcare providers and the innovation community around the world has been doing during this pandemic. So I feel like this is a very unique opportunity to get some perspective from the inside from Mark and David. So let me start with kind of a broad question that I'll put to Mark first, and then David, you know, perhaps you can elaborate. You know, the first question is really, you know, one of the biggest challenges with the coronavirus is that it is the novel coronavirus. We haven't seen it before. There is no sort of universal playbook as to how to treat patients, how to manage healthcare workers' safety, you know, during this kind of situation. From your perspective, how have clinicians and non-clinicians responded to that challenge, Mark?
Thanks so much, Kelly. A pleasure to be here. You know, I think that it's been an incredible time for our healthcare system and folks in the community to come together and really really work together to try and get through this. So, you know, the social isolation work that's happening just throughout our communities to flatten the curve. And then when you look at kind of all the different clinicians that are pitching in to help take care of patients during the surge in Boston, and hope, you know, thankfully we're past surge and things are slowly calming down. It's been incredible to see just all the support clinically and in the community. I think for innovation, particularly the digital space in healthcare, one thing that COVID-19 has really pushed forward is just rapid and massive adoption of digital technologies. Things that, you know, as part of the Digital Innovation Hub at Brigham and Women's, which is essentially the Center for Digital Health at Brigham Health, we support our innovators, you know, before COVID and during on all kinds of digital solutions. But the pace and rapidity of how quickly things are being adopted, both by our health system and also by our patients and clinicians, has just been incredible. You know, I don't know the specific number, but I think the adoption of telehealth visits prior to COVID-19 and post COVID-19 within our organization, you know, it's like an incredible percentage, like 3,000% increase just during this time. And, you know, I think because of that, we're in this new place, and it's exciting to see what will happen in the future.
Thanks so much. And so David, have you had a similar experience? Are you seeing different kinds of collaboration on the ground? Are you seeing a different willingness to experiment under the circumstances?
First of all, thank you for having me here. In Israel, we are a little bit, not a little bit, we flattened the curve. So actually we are going out of the, at least this instance of COVID. We took a little bit different measures into our healthcare system. In the matter of, for example, after like few days, I think, or a week or two, we understood that we need to take care of the healthcare employees. So we started to work in operations of capsules. That means 3 different type of teams that see only one each other. So if one team will be exposed to COVID, the other teams can keep on operating and treat patients. We actually opened COVID departments separated in every hospital that we have. So they were isolated from the hospital activities. The Ministry of Health actually also decided to decrease or to almost stop all elective procedures in order to make resources available for COVID patients, because we did not know what's going to happen next. And maybe the most important thing also related to innovation is that we opened a national center to manage and control all the efforts and activities related to the COVID, and the partners in that headquarters were out of the healthcare system. So, for example, the Ministry of Defense, the Mossad, all the defense industries in Israel, tech industries, all of them were concentrated in one location and in multidisciplinary teams and thinking together how we can actually solve these problems. Now, related to the data, like Mark said, we are fully, I would say, data-oriented about 40 years or something. So we have EMR, we have interoperability between all our healthcare system, our HMOs, the hospitals, and so on. So we thought, what is the next step? And most of them were the prediction and analysis of what are the patients that are going to be on the severe case and how we're going to treat them and how we're going to, to try and be prepared for the worst before it comes. So this is just generally speaking.
Yeah, it's an amazing story, and it's a really interesting compare and contrast in terms of the level of integration of information systems of clinical care into other government agencies and the like. That's quite different, obviously, I think, than what we see in the U.S. You know, I'm curious, and I'm going to put this question back to Mark. Where has technology been helpful in terms of the kind of collaboration and coordination and data analysis that David just described? And where has it actually been a hindrance? What have we learned about sort of our technological weak spots from this experience in the United States?
Yeah, so I think that, again, technology has been a huge boon for a lot of our COVID-19 efforts. And particularly at partners and some of the work that our team at the iHub, along with others in IT and innovation throughout our organization, have been working on. We're using it in many different ways. One is, it's an incredible tool for triaging. So we were one of the first systems to utilize Microsoft HealthBot's chatbot platform to help triage folks who either might have symptoms or are worried that they may have been exposed to COVID-19. You go through a simple a chatbot algorithm, and depending on the response, you either get diverted to our hotline for further evaluation, or you get some direction, self-isolation, or your risk is low. We implemented that about a week after the chat, COVID-19 really hit the West Coast, and it's been a great tool to help kind of triage the public who might be concerned. It's at covid.pers.org. Another piece of technology that we implemented very quickly and has gone to scale is employee self-attestation. So in mid-March, the Department of Health, Public Health in Massachusetts had an order that basically said that any employee or visitor that comes into a healthcare facility needs to be screened for symptoms of COVID-19. And if they have them, they can't come into the facility. This is a paraphrase. And right around that same time, partners also created a policy internally that any employee that is working inside of a facility taking care of patients is now required to wear a face mask. So what we actually created internally was a application called COVID Pass, which is a very, very quick employee self-attestation tool that you log in using your user ID, your partner's user ID, and you do one simple question about symptoms related to COVID, and then you get your day pass. It's like a fast pass. I can actually show you mine. And when you do this, what ends up happening is this is your ticket to get into the hospital as a clinician. So this is my fast pass for the day, and it's also how you get your face mask. And we implemented this in about 4 to 5 days total from beginning to end, and scaled it out to the entire system within that week. So we've actually recently crossed over 1 million attestations. If you do have symptoms, that data is given to our occupational health for further follow-up. And this is a self-attestation, but we've actually been able to alert occupational health to over 2,000 employees who have had symptoms and then got further workup. So it's been an incredible tool to not only get a sense of, for safety for our employees coming into the hospital, that others aren't symptomatic, but also it's been a great tool just to estimate, how many face masks to give to order for each facility. I actually recently heard that at the Brigham, we're using the COVID pass numbers to also estimate, how much food to provide for our staff. When they come in, we can get an accurate estimate based on the COVID pass numbers. It's been incredibly helpful to see that technology, and what we're seeing is now scaling across, not only throughout our institute, but now other institutes are utilizing COVID pass as well. So it's really pushing that forward.
So thank you so much. And let me put the next question to David, but of course, Mark, I'd love to hear your thoughts as well. So I think both of you described this context in which, under these incredibly intense circumstances, individuals and within organizations and beyond are coming together, finding solutions, creative problem solving, all the kinds of things you'd want to be happening under these circumstances. Do you have any concern that after this period of, as I said, an absolutely intense learning, that we're going to lose it all? We're going to go back to our day jobs, and that we're going to miss an opportunity to spread the experiences and the learning that's happened through this. I mean, and if it's not a concern, why not?
So maybe, first of all, I think we will lose something. Of course, you are in a situation like the COVID. Everybody is very intense. Everybody is focused to solve a solution. Our prime minister, he managed actually the crisis, so it was very on the focus of everyone. And now it's going, a bit fading out. So probably we'll lose some knowledge. But again, as I said previously, we learned a lot, and I think that we are, at least in Israel, we prepared ourselves and learned a lot from this situation and how to be prepared for the next wave, if there will be a COVID wave or a next wave of something. Maybe just would like to give you one technological example. The Israeli Shin Bet, which is the equivalent to the FBI, has developed and implemented an app. It's called the Shield, and more than 2.5 million downloads and active users out of 9 million civilians in Israel. And basically, it's very simple. It tells you if you had an overlap points found with a COVID patient, and immediately. So this app is connected to all the mobile operators, and it actually, you don't know who you met, but you are exposed. And now you can actually go into quarantine automatically without nobody needs to do an epidemiologic research and so on. So this is something that after it's already implemented and downloaded, we already learned how to operate it and how to move it and how to do it. So I think these kinds of solution technology and actually thinking out of the box how to solve this type of crisis, we will keep that, at least in Israel. But we'll probably lose some of our initiatives and some of the ways that we perform.
Mark, are you equally optimistic?
Yeah, I mean, I think that what we're seeing with I'm a physician as well, and I would say that with COVID, that was the systole, right? We saw a huge surge of activity, a lot of great applications quickly of technology, and as kind of post-surge, and things are kind of calming down in Boston at least, I think that I don't think we're going to lose much, but I think in that diastole, when we have some time to reflect, my hope is that we can then start thinking about some, further considerations about how to, responsibly utilize these technologies. So I think contact tracing is an incredible tool, but there are also there are a lot of considerations that we want to think about if we implement it, in mass.
Right.
And I think that this is the time post in the future after COVID-19, hopefully when there's an after COVID-19.
Right.
I think that what we're going to see is that a lot of the technology we're using, we will continue to use and we will refine, but hopefully we'll have that time to just think about kind of the things that we normally would consider far longer before we implement
Right.
in the future.
Well, so let me ask you both, and we can start with David. Is there a use of technology that has particularly surprised you during this time? Sort of a moment where you were sort of thinking, "Oh my gosh, I would have never thought to apply this to that problem." Any surprises?
Yeah, a lot of surprises, especially if you go to the respiration machines that, solutions came out of nowhere. So you saw engineers coming from the military and from the defense industries for solutions that you have, never thought of it. And you say, okay, this is mind blowing, or coming with ways to do screening and PCR testing in massive amounts. And this is one of the major, I think, things that there was a huge debate in Israel between, by the way, the Ministry of Health and the Ministry of Defense, which is, awkward that this is the debaters. The Ministry of Defense said, we need to do a lot of testing. The Ministry of Health said, this is not effective. We don't need to do that. Eventually, they decided we need to do massive testing. And when we moved to massive testing, we saw that it's actually what I would like to call, it's an engineering problem. You need to do 20, 30, 40,000 testing a day. While at the beginning of the COVID, we did only about 1,000 a day. So how do we do that? How we mass production stuff like that? And there were a lot of solutions and innovations inside of it that it was mind blowing. So yeah, a lot of innovation, but actually I have to say, most of them are outside of the healthcare system. Military, defense, pure tech companies, and so on.
So it's an interesting question. So let me actually ask a slightly different question, Mark, building off of that. I mean, so there's sort of the fundamental question of what uses of technology surprised you, and were there any? I guess the way to put it is strange bedfellows, as David just described, some unusual collaborations that you wouldn't have anticipated.
I'm not sure it's a strange bedfellow or unusual, but I think I'm not even sure if it's that surprising, but I would say the MVP of like within healthcare for COVID-19, I have to say it's the tablet, particularly the iPad. I think that's the thing that really became instrumental in so much of our clinical care and so many of our innovations. We have that tool has been utilized so fully with a lot of the work that we do. So, one thing that was surprising, but maybe not in retrospect, makes a lot of sense is, as part of our COVID efforts, we like many different healthcare systems, really limited our visitor policy. And, as a patient who could be very ill, particularly critically ill with COVID-19, that can be a very isolating and scary situation to be in. You're in this room. People are primarily interacting with you fully gowned, so you don't know them, and there's no one you know. And particularly if you have a language barrier, or it can be incredibly scary. And one thing that we implemented at the Brigham and at Partners is a program to actually help patients in the ICUs actually have video visits with their family. And it's such a, it's one of those pieces where the technology, there was nothing fancy about the technology. It was literally Zoom meetings, but the impact was so incredible And it really brought forth the humanity of why we do the things that we do. And the iPad was the thing that really enabled that. And I thought that was just incredible to see.
So I'm glad that we can end on the concept of the way technology has enabled humanity, you know, in this really difficult circumstance. It's a powerful reflection. So thank you, David. Thank you, Mark, so much for answering these questions and sharing what you've learned. And with that, I am going to turn it back to Nick.
Well, thank you, Kelly. Thank you, Mark and David, for a great panel discussion there. We are now going to jump right into our innovation spotlights. We've got some amazing MassChallenge entrepreneurs that have been innovating in this space. And I would love to start right away with our first presenter, which is going to be from HealthNote. So Josh, let's dive right in.
Thanks so much, Nick, and thanks everyone for having me today. So my name is Joshua Reicher. I'm briefly going to tell you today about how HealthNote is reducing documentation burden during COVID-19. And we can go to the next slide. So the problem is something that we already all know, right? There's over 1.7 million cases of COVID-19 in the US. There's a high rate of transmission. Healthcare workers and patients are at high risk, and there's been a massive shift towards telemedicine. We can go to the next slide. And so the goals in healthcare are really to minimize that transmission, improve screening, reduce patient viral transmission, and reduce nosocomial infections. Next slide. And so HealthNote's a platform that screens, collects, documents, and triages patient data before an encounter. Next slide. So what we do is we automatically ask and document questions a doctor would usually ask. So similar to what someone mentioned earlier, in terms of chatbots, we ask those questions, but we take it a step further and we actually write a conversational note that a physician would write. There's no login or download for a patient, and this can be implemented in minutes. Next slide. And so we have 3 ways to direct patients. They can get a direct SMS or email. If it happens in a hospital, they can go to a website, or this can also be done in a QR code. And we actually implemented this at one of the largest ERs in the country. Next slide. Here's an example of what would be on the sort of screens at the hospital. And so essentially it's telling patients to go to a certain website, or they can take a picture on a QR code if they're already not in the EMR. Next slide. And so here's a little bit of what it looks like. You can go to the next slide. And you can think of this as TSA pre-check at the airport. We tell patients, we tell staff where to go, whether it's in the, whether they need a mask or they don't need a mask. Of course, now everyone's wearing a mask, but RDU is respiratory distress unit. So it's kind of telling folks where to go. Next slide. Nope. And so HealthNote's impact during COVID-19, essentially for primary care groups, we've been helping increase access by helping write notes and collect data beforehand. We're enabling primary care offices to do more with less. For specialty groups, we're screening for COVID symptoms, and they're telling us we're essentially helping them prepare for the post-COVID world. For telemedicine, we're finding that we're becoming this critical layer between physicians and patients prior to a visit. And all of the folks that we work with right now are using HealthNote for both in-person and telemedicine visits. Next slide. And if you're curious to learn any more about HealthNote, feel free to email me at josh@healthnote.com. Thanks so much.
Thank you, Josh. And really just awesome to see how you've been able to pivot to address some very clear needs during this time. And it's been awesome to see you growing and expanding to make that impact. So thank you for your work. Moving right along, we want to move into our next awesome company here. So feel free to come off of mute and take it away.
Absolutely. Thank you, Nick, and thank you everyone for having me. My name is Amir. I'm the CEO of Knox, and I want to discuss today how we use the Knox genomic AI engine to help COVID research and help with genetic data of COVID patients specifically. So Nick, if you can hit the next slide, please. Knox develops an AI engine that helps highlight potential genetic markers, either for single patients or for cohorts of patients. The unique of what we do is we're doing it by building community of knowledge, meaning that we have different communities that upload genetic data of patients, collaborate on those, on those genetic files and on the findings on the clinical symptoms, allowing our AI engine to learn from all those data and provide feedback and provide the most relevant evidence that may lead to the potential marker. During the COVID and the pandemic situation, what we did and how we adapted the engine is we allowed some research collaborators to upload cohorts of COVID-19 patients' genetic data and allow them to collaborate and use our engine in order to rank potential markers across the different cohorts and also compare it to other, cohorts of patients that were not affected by COVID. And by doing that, they could highlight potential markers for those who expressed more severe symptoms of the disease and allow them to find markers that may lead to either a vaccine or a potential drug. In the next slide, you can see some collaboration that we did with the Hanover Medical Institutes that basically, uploaded and took cohorts of patients, of COVID-19 patients, and they are going to do one of the largest susceptibility genetic research study for COVID-19, and Knox allowed them to help them and to use our AI engine in order to prioritize those markers. So if if any institutes that hear us now and has cohorts of patients or wants to work on genetic data of COVID-19 patients, feel free to shoot me an email or contact me. My email is amir@gnox.com, and you have all the information below on the slide. And I want to thank you again for the opportunity.
Yeah, thank you, Amir. And again, great progress to see this really exciting research initiative that you're launching. And I'm excited to see what kind of collaborations will follow this event. So thank you again for presenting today. All right, so next up, we have Abu Ardan. And feel free to take it away.
Great, thank you, Nick. Thank you very much for having us here. So my name is Namet. I'm the co-founder and CEO of Abu Ardan. Next slide, please. So Abu Ardan, next slide. So Abu Ardan mainly is a poultry management solution that empowers poultry farmers to have more control and more efficiency and visibility over their operations. And we leverage mainly new technologies like artificial intelligence and machine learning to predict the performance of the chicks to give the production manager a way to take corrective actions on time. Next slide, please. So what we do mainly as a value proposition to our customers and poultry companies, we identify inefficiencies throughout the whole poultry value chain. We control fraud from the frontliners, and we save time to all employees in the organization or in the company itself. And the estimate for this, for at least 7.5% of the revenue, and the estimate for this for any company would ranges from 5 to 120 million per year. This ranges from, it depends on the size of the company itself. Next slide, please. And since the poultry is very essential, and now being essential than ever, we are offering additional services as a response for COVID-19. We help and empower our existing customers and new customers using task list distribution tool, where they can distribute tasks related to COVID-19 tasks as a biosecurity, for example, tasks to farm managers in multiple locations, and this is mapped directly to their flocks, to respective ages of their flocks. And we also provide communication tools for production managers, vets, and executives to communicate with farm managers on site to reduce regular visits, to reduce, of course, the spread of the virus. And as well, we're offering 50% discount to our producers, and newcomers, of course, through fightcorona.abuerdan.com if anyone can go there. Next slide, please. And to get involved, you can visit our website at abuerdan.com. And if you can refer us as well to any funding agencies that can help poor farmers in order to be more efficient, they can visit fightcorona.abuerdan.com, or they can simply send me an email at namet@abuerdan.com. Thank you very much, and back to you, Nick. Thank you.
Thank you so much. And I think what's amazing, what I love about some of these innovations is that it really shows that we are all trying to make the best of this situation, and everybody is jumping in to help. We need food, so it's important to be able to support our farmers. All right, so next up we have Lighter.
Sure. Good morning. My name is Anuj Patel. I'm the CEO of Lighter. Lighter is in the personalized nutrition space. We build technology and services to improve health outcomes. We're a team of engineers, product designers, nutritionists, dietitians, and data scientists, all working holistically to address some of the root causes of our chronic diseases that are in the United States, in the sense that we try to drive towards behavior change and trying to improve people's diet through our food as medicine principles. Since inception, we've helped individuals eat over 1 million healthy meals. Moving on to the next slide. So when we think about COVID-19, it's really been an amplifier for some structural issues we've seen in our food supply and in our healthcare ecosystems. And what I mean by that is that COVID-19 has really dramatically increased, some of the disruptions in supply chains for food. There's obviously issues in terms of, processing plants and school closures that have, hurt people's ability to get access to food to put on their table. Secondly, there's been a dramatic increase in risk associated with what I would call lifestyle diseases. This data just from New York City indicates that there's dramatically increased risk with obesity, diabetes, and heart disease. And what we're trying to do is address all of those points with Lighter, and specifically our Lighter Health product offering, which is an intervention program that combines offline and online tools to address some of the comorbidities and food security issues that we've seen from COVID-19. There's also the idea that our program has been tested in pilot settings, and we've seen dramatic or incredible results in the sense that we saw big reductions in total cholesterol, reductions in blood pressure, and reductions in weight. And we're seeking to sort of expand upon that and move more into the healthcare space, working with populations such as health plans and ACOs. We're currently in discussions to scale up dramatically our Lighter Health offering as an intervention program to manage patients at scale to improved health outcomes. Moving on to the final slide. And so, we want to talk to you. So you can reach me directly at anuj@lighternutrition.com. Anyone in the healthcare space, with health plans, ACOs, or self-insured employers, we'd love to talk to you about implementing our solution to address population health conditions. Thank you.
Thank you. So that concludes our last of our innovation spotlights. Really amazing to see.
I think Nick might be grappling with some challenging Wi-Fi conditions. So
that's true. I will hand it off.
Thanks, Nick. I'm Yonit Sirkin. I'm the managing director of MassChallenge Israel. And I'm really thrilled to be here on this panel, introducing you to some corporates who are usually outside of the traditional healthcare space, but have made some pivots or changes in light of the current COVID crisis, really to contribute both of their skill and talent, and also to give us a perspective on how corporates around the world are really thinking about not only the COVID crisis, but the day after it. So I'm thrilled to be joined here by Chris Lloyd, Managing Director of Healthcare and Life Sciences and Commercial Banking at JP Morgan, who's joining us from Boston, and by Israel Lupa, the CTO and Executive Vice President of ELTA, joining us here in Israel. So let me start actually, Israel, with you. How has life changed for your business as the COVID-19 crisis has unfolded over the course of the last several months?
Okay, good afternoon, good morning. Thank you, Unit. So we are normally a defense company, okay? So we are dealing with the intelligent systems, normally radars, communication signal intelligence, and we work with you for more than 3 years in our innovation program. During the COVID crisis, we were required by the government to reduce our working force. So actually, all my team worked from home. The first days, I was engaged in reorganization of the company in a way that will allow us to work. But then after, I was only dealing with trying to solve ongoing needs of the health community. We were approached by the Ministry of Defense, the Health Ministry, and the hospitals by daily basis with new needs and new requirements. And in any case that we thought that we can put a solution in days, we put a multidisciplinary team and make a prototype in a few days or maximum a few weeks.
So that's incredible. So the regulatory bodies would come and promote challenges or let you know what the challenges were. And here you were able to think about creative ways to solve those with a multidisciplinary team. Chris, this is a financial institution, your day-to-day life is around lending, mergers, acquisitions, helping companies really launch and stay afloat. What have you seen of either the healthcare clients or the life science clients that you're working with, or other financial institutions in your space? What have you seen their effect of COVID on their business?
Yeah, absolutely. It's been an interesting time, and as I somewhat separate our business into sort of two distinct segments, one would be life sciences, and the other would be healthcare services, which is more of what you would think of as traditional physician practices providers. Some of those, it's a very different story. So on the healthcare services side, the volumes of patient visits have gone down quite a bit, right? Everybody's kind of dealt with that over the last several months. People just don't want to be anywhere near a healthcare facility right now while the virus is out there. That's starting to rebound a little bit, but you've seen a lot of innovation come from that just out of necessity, right? So a lot of different types of healthcare that's practiced and procedures that you wouldn't think could be done remotely or through video. Turns out you can in some cases. We have one physical therapy practice that has been doing more telemedicine visits, and there's some things you can't do physical therapy wise, but there's plenty of things that you actually can do having a practitioner watch you do things. So there's been some innovation, and a lot of people talk about how the future's kind of been brought forward in healthcare, and you're seeing you're going to see a lot of change going forward in terms of the willingness to look at those kinds of things. And then shifting gears on the biotech side, this is sort of the industry that I think a lot of people feel is going to hopefully one day develop some solutions to this problem. So if anything, there's, I think, even more interest in biotechs and drugs that can combat the virus, but also a host of other things. So that continues pretty steady in terms of progress.
I think, Chris, this message about, we know that necessity is the mother of all innovation, and here we certainly see a time of great need, and a lot of healthcare related or life science related companies that are making those transitions. Israel, I'm interested in why is it that ELTA, as you said, traditionally a defense company, why did you make this transition? Why did you answer the call to develop new products? And how did you choose which were the ones that you could actually affect change on, perhaps even share a little bit of those products?
Okay, so business-wise, we are an export company, but our DNA is to support our country. So we put our country first. So it was clear from the beginning that we need to put aside our daily business, and in parallel to that, we need to try to help as much as possible. So even though we are not a health company and we have not much knowledge in health necessities, our technology was easily adapted to those cases. So we can help in transition. Just to give some examples, it was easy for us to take some active air gas masks that we have in stock for thousands and just adapt them for the needs of the hospital and to protect the doctors and in the hospitals. It was easy for us to take our 3D printers and just manufacture out of stock parts that the hospitals needed very, very rapidly. As David mentioned in the previous meeting, we also manufacture our own respiration machine, and we also make some bots for the hospitals to help reduce the load. Probably the most interesting solutions that are the ones that we're able to change or to relocate our core capabilities to the needs. For example, we use our radars to create a system that is able to measure vital signs without touching the patient. So a stand-off system in a way that we protect the health community and the health community in the hospital and prevent the COVID new patient to infect the hospital in a way that we are able to measure their vital signs without even approaching the person. We also leverage our command and control capabilities in a way that we can design control centers for COVID rooms. As was mentioned before, our hospitals were guided by the health community, health ministry, to open new COVID rooms, but these rooms lack command and control systems. So we take our command and control capabilities and put in a few days remote assistance capabilities and command and control capabilities to these rooms.
What I love about what you're sharing, Israel, is that it's really, it looks like the self-reflection, understanding where you have unique skills, whether it's around the technology specifically, the radars, of course, and then the command and control, and then augmenting it or really shifting it to support this healthcare effort. Chris, I wonder from your perspective as a banker, what are you seeing companies looking to do in terms of making a difference in the long term, right? Do you see companies that are making shifts long-term towards supporting healthcare industry or life science companies, or is this something that is an ad hoc or a momentary sort of call to action, or is this something that's going to be more long-standing where we see a variety of companies that are stepping into the healthcare space and supporting the healthcare space?
I think there's been, one of the areas that I've spent a lot of time in and have been the most excited about is, this healthcare IT or health tech space, where people are the intersection of healthcare and technology. And I think there's been interesting companies formed over the years to, tackle some of these problems, whether it's, diagnostics or using big data and healthcare and some of these things. I think that this probably will, accelerate or even create more opportunity in that area. So I think the answer to the question is there are some long-term opportunities that are here to stay, in terms of the way that medicine is practiced, the way that healthcare is delivered, the way that we can get more data and information about healthcare. There's a big emphasis on primary care and preventative medicine and changing that primary care model and using more technology, more virtual visits, to make that more accessible. So I think there's a lot of things that have already been kind of in the works, but this has sort of accelerated some of those trends.
This is great. So one last question for each of you, and Israel, I'll start with you. What's your advice for a leader of a corporate who's guiding their team through these sort of changes? How did you energize your team to support this effort that is clearly so very different from their day-to-day operations?
First of all, you need to be aware that in these cases, timing is everything. So the crisis is now, and you need to provide solution now. So if you want to help, you need to put a highly motivated team with the resources and the low bureaucracy in order to provide a solution in very short time. Otherwise, it's useless. You will have a solution when it's not required anymore. Second, we need to understand that in most of the cases, the customer is confused and unorganized. And you need to give him a hand long before he can give you a purchase order.
Excellent advice. Chris, what are any last thoughts that you'd want to share from your perspective working with companies that are either on the front line or near there looking to make an impact on this current crisis and then growing far beyond?
Yeah, I agree. Some of the, what Israel said, I think it's, especially for us in a service business, we talk a lot about staying close to your customers and just understanding what their needs are and knowing that, that this is, it's a little bit of a cliche, but this is something that we're all experiencing at the same time. So there's definitely opportunities to help and to serve customers and colleagues and others at times like these. So I think people do get a sense of hopefully purpose out of doing that. And so that's something that we talk about a lot.
This is great. Guys, thank you so much. I know we hear so much about corporates who have so much opportunity to make a difference in the world. And here you are, both of you representing two leading companies on either side of the Atlantic that have really taken up the mantle and supported this effort to help companies stay afloat, to help grow new industries, and to help create solutions that are driven by true need in the healthcare space. So thank you both. Thank you, Chris. Thank you, Israel, for joining us today.
Thank you for having me.
Thanks, guys. And thank you to everyone for being here on this call. As Nick said when we opened this, we came to approach this series, this effort, really from a place of understanding that this was a global pandemic that has global implications, and it also has global responses. And so we are interested in seeing how best practices are utilized around the world, recognizing what MassChallenge has always stood for, which is that great ideas can come from anywhere, and that we want to be able to percolate to the top, really the best ones that can help grow our economies out of this crisis and adjust our realities as the conditions continue to change and continue to morph. I'm actually going to ask you not to pay attention to the dates on this slide because they're a bit outdated. But as we said, this is part of a series. This is the first, or rather the second of this series, and there will be more. So I am really excited to invite you to join us on June 30th at the same time as we launch our next one of these meetings called Zooming into the future of work. I think all of us have gotten to know this platform, this Zoom platform, newly very, very well. And we are really thrilled that we're going to be joined by the CIO of Zoom, Harry Mosley, to help lead a conversation about how the realities of work will be changing as we recover out of this crisis. We're also going to be joined by leaders in the human resources space, as well as the cybersecurity space, recognizing that one of the needs that this industry, or that all industries have as we grow and develop new workforce mechanisms, is to keep our enterprises and information safe. Stay tuned on July 14th for a future of fintech conversation, where we'll be talking about how fintech, e-commerce, and retail will look as we again recover and look at the future of 2020 and beyond. So I invite you to stay tuned for more information. Come and visit our website, where you can find more interesting summit meetings where we will get together and share best practices and ideas about growth and recovery out of the COVID-19 crisis here with MassChallenge. Thank you again for being here. Thank you for sharing your ideas, and we look forward to seeing you again.